Yeah, go from here. So welcome everyone. This is the second training in a series of 8 trainings that are provided by the System of Care of Clackamas, Multnomah, and Washington County. These trainings are happening on Wednesdays at 12 p.m. throughout November, December, and January. Registration is still open for the remainder of 6 that we recommend you come to. They're all on great topics around navigating systems, accessing services and supports, that kind of stuff. Housekeeping for today, we are being recorded so that we can put this up on our website and have it be available for folks who weren't able to attend. Please stay muted throughout the training. There's going to be around 20 minutes of time to ask questions at the end. Put those in the chat as we go, and I'll be tracking those, and we'll read those aloud to the presenters after they're done presenting. And if we run out of time for the questions, we're going to type up some answers for you. We'll collect all your questions from the chat. So let's see, I just want to share a little bit about who System of Care is. We're a regional cross-system collaboration of youth, families, and system leaders who are working collaboratively to improve the services and supports available to children, youth, and families in the region. We want to make sure that our services are well coordinated, youth and family driven, community-based, and culturally and linguistically responsive. Our work is dependent on you all sending us barriers. So we need to know what you're seeing out there that is not working, or things that you know should be different and that you'd have a recommendation around. So we have a website where you can go to enter a barrier. I'm not going to click over to that because that means like unsharing my screen and sharing a different screen, but go to www.systemofcare.net. We have more training resources on there. Our videos will be up there. You can submit the system barrier and you can learn how to get involved in some of our collaborative efforts. So we appreciate you coming today, and I'm just going to pass it off to Talk and Alexa to introduce themselves and get started on the content. So thanks, everybody.
Great, thank you, Brian. So my name is Alexa Jett, and my pronouns are she, her, hers. I'm the Oral Health Integration Manager at Care Oregon. I am a dental hygienist by training and my background, and I've been with Care Oregon for 5 years. In my role, I support primary care providers, behavioral health providers, and dental providers to help get patients into dental care.
Hi, everybody. Thank you, Brian, for that introduction. Thanks for having us. Before I introduce myself, can you all see the screen? We practiced, I promise. It's working. Awesome. Again, thank you so much for being here. Wow. On November 4th. Cool. My name is Talk Sonali Gillespie, and my pronouns are she, her, hers, and I'm the Social Services Manager with Care Oregon. And what that essentially means is I get the privilege to support and facilitate the social determinants of health and community health work, particularly with our community-based organizations. As Brian said, like, we need to hear from you what the barriers are, and I cannot express enough how important you all share that with us. I don't come from healthcare. I actually come from community-based organization work, and I'm new to this field, and I'm often saying to folks, hold us accountable. And folks say to me, well, how do we hold you accountable if we don't even know what you do? So that's why we're here today, is to share a little bit about what we do and how we can really partner together. And because we all know that healthcare is a really complicated topic. And full transparency, Alexa and I are struggling because this is usually a conversation that takes about an hour. And Brian says, all we got is 30 minutes. So we're going to fly through. Yeah, and we are storytellers. So we told ourselves we cannot do much storytelling, if any. We're just going to keep it linear, like how folks in the Western world think. So we're going to try our best here. And please chat in if you have questions, even as we're talking. We love that.
Great. So just real briefly about Care Oregon, we are a nonprofit health organization. We serve the state of Oregon's Medicaid and Medicare populations. We'll be going through what that exactly means. And we're here to build stronger communities by making healthcare work for everyone. It's 2020. We're still here. What an appropriate quote from Martin Luther King, but this is where we're coming from when talking about social determinants of health, and I'm coming from the health plans. How can we help our communities receive health care?
Right, we talk a lot about health equity, right? We all as a system need to figure out how to break that down, right? We all have to level set. And I think this is a great way to just kind of frame it up before we talk about healthcare and recognizing that not everybody has it.
So I work in this structure, and even I feel like this slide some days with who do I call, who I email, what organization, how do you figure this out? And this is what hopefully by the end of our time today, we can help figure out some of these lines. And if there's questions, we are here afterwards via email and phone call as well. So this is what we're going to try to break down and demystify.
Thank you, Rutgers University, for creating this slide deck or this slide. We love it. I mean, imagine, right? If it's complicated for us, what our families and individuals that we work with have to go through. I don't think you all have to imagine, you all know. So today we're going to talk, I mean, we all know that there are folks who are uninsured, right? We also know that there are folks who have private insurance. And we know that there are folks who have public insurance. That's what we'll be talking about today is public insurance. And going back to what I shared earlier, level setting. I know we're not supposed to ask questions, but Alexa, I'm gonna have to. Who can put in the chat what public insurance is? Name some. Read them out, Brian. Are there any chats?
I saw one from my friend Nicole. She said OHP. I'm seeing OHP. I'm seeing
Awesome.
Providence. I'm seeing lots of different names here. Health Share with exclamation points. Kaiser.
Woo! Yes, those are part of the public insurance sphere, right? That's what you want to call it. But yes, Medicare, Medicaid, that's what we'll be talking about today. And it's really complicated, right? The way I understand Medicare is the red, white, and blue card. That's how I understand it. And that's how I refer to it when I'm out in community. And then Medicaid is the OHP card, the Oregon Health Plan card. And I love this visual, this image, because it helps me understand the difference between the two. And the other way I understand Medicare is I think of where I come from, we love our elders. We respect our elders. We care for our elders and those who are disabled. So that to me is Medicare. And then Medicaid, for the CAID portion, I think of those who are low income, right? How it was designed is really for that population. So that's one way to think about it.
So we're going to start with Medicaid and familiarize ourselves with the different cards. So there's going to be a card theme throughout this slide deck. The card is a valuable tool, and it's a great starting point for understanding who to contact on behalf of your patients or clients. So the Oregon Health Authority administers Medicaid, which is called Oregon Health Plan, or OHP, as you were chatting in. It's free healthcare assistance for people who are low income, and it covers physical health, behavioral health, and oral health. When you're approved for Medicaid OHP, you initially receive this card, the Oregon Health ID card. For tribal members and for those who are incarcerated, this is the only member ID card they will receive. It's also referred to as the open card. So that allows them to see any provider that accepts Medicaid OHP. Within about 10 days to 2 weeks, those who are not incarcerated or are a tribal member receive a member ID card with their assigned coordinated care organization.
And this is where it gets a little clunky.
We like acronyms, so you'll hear those called CCO. CCO, there are multiple CCOs in the state, coordinated care organizations. The CCO is responsible for ensuring members have access to all Medicaid/OHP covered benefits and services. So that member ID card from their CCO will have their health plan assignment on it. And those in the Metro Tri-County area who are assigned to Health Share of Oregon CCO will receive this Health Share of Oregon card. So as of September 2020, there is another CCO here in the Tri-County area, and that's Trillium. They're also, they've been in Lane County. So that's another CCO, and they, we do not represent Trillium. So the rest of the presentation, you'll see it more the Health Share Care Oregon focus. So if you have questions specific to Trillium, we won't be able to answer that, but we are providing more of the basic OHP, and we can address basic OHP navigation questions as well.
I just am curious, how many folks already knew about Trillium being in the Metro? I'm not able to see everybody. What are they saying, Brian, on the chat?
Didn't know. Yes, but I'm a little confused about that.
Right?
Certain
See?
Yeses, yep.
It's all right. We're confused too.
So this is the updated map of 2020 of the state by counties, and then the CCOs that those counties are in.
How many CCOs, take a guess, do you think there are in Oregon total, the coordinated care organizations?
12, 13, 17, 14, 15, 10, 20, 25. What is it? How many?
Is it 15, Talk? Are we at
Yes,
15?
it's 15. I'm sorry, I was on mute.
Yes.
15. Whoever said 15, that's the answer. And
So-
here's another way to think about the whole CCO structure, because I think it's so important to understand the structure before we even begin talking about Medicaid and Medicare, right?
Yep. You have the Oregon Health Authority, OHA. Remember, we like our acronyms at the top. And then in the metro area, we said we were going to talk about Health Share, CCO. So then we have Health Share, and then the health plan. So this is where we're going to go into this a little bit more. Health Share has health plans that they work with, Care Oregon being one of them. And then Care Oregon contracts with their provider network. So the doctors, the nurses, the dentists, the behavioral health specialists. And the most updated structure would include Health Share of Oregon and Trillium on that green second tier. Mm-hmm. And because Trillium is a CCO and a health plan. So yes, it is complicated.
So who is the CCO again for the Tri-County area that we'll be talking about today?
So we're looking at Health Share, yes.
Yay. And where can you find that information? Right here on the corner. I know this is so basic.
We talked about a theme, a card theme, and when Talk and I do this presentation, we act like, you know, this is like the bus pass. If you're trying to get to your healthcare, your ID card is the bus pass to help you get on your pathway to access. But if you don't have or if you can't find, or if you don't remember where the card is, that's okay, because we know how to help get you one. So that is something, Talk, do you want to let everybody know? Because we will be focusing on the importance of the cards. But
yeah, you can actually go on to the Health Share website and print this card out for the individuals and families that you're working with.
So the next few slides, we'll talk about how to read the card and what the valuable information is that you can receive from that.
So we're going to talk about one last piece of the structure. This is another way to think about it, right? Alexa mentioned that OHP, also known as Medicaid, covers physical health, behavioral health, and oral health. How many of you can tell us, and I'm going to try to phrase this very slowly because I always get caught up as well. How many can tell us the 5 health plans that manage the physical health benefit for HealthShare? Is it coming in the chat? So there are 5 health plans that manage the physical health for HealthShare.
We've got Kaiser, Providence.
Yay!
Through.
Kaiser, Providence. Who else? We got 3 more.
Moda, so that's yep. OHS.
Yeah. Yay! 1 more. Well, 2 more.
Care Oregon. All Care is a CCO in Jackson County, down in Southern Oregon, Josephine. Quality.
Yay, there you go. Providence, OHSU, well, Legacy, Kaiser, and then Care Oregon. Again, these are the 5 health plans that manage the physical health for HealthShare. I'm deliberately saying it like 3 times because I even have to hear myself say it. And then for behavioral health, who can tell us who manages this benefit for HealthShare, the CCO?
Talk for time. I'm actually going to give the answer because I don't
okay.
come up yet. Care Oregon.
And then for dental, it even gets a little bit more complicated. So I'm just going to click away.
Yeah, so for dental, if you have HealthShare of Oregon, Care Oregon, the health plan, Care Oregon has that relationship and holds the contract with the 5 dental plans, of which, let's get even more complicated, Care Oregon Dental is a dental plan as well. So you have Care Oregon Dental, Willamette Dental, ODS, Advantage Dental, and Kaiser.
Now let's get into the actual benefits, right? Here we go again with that card theme. So this is what the back of the Medicaid OHP card looks like. And I'm sure many of you, if not all of you, have seen this, you know, from the individuals and families that you work with, right? And how many of us actually know how to read it, right? So if you look on the back of the card right there on that left side, that's where it tells you who the member or the family is assigned to. So for this person, they're assigned to the Care Oregon physical health plan, and their primary care clinic is also on the back of this card. Some people are going to clinics where it doesn't match the card, and that's okay. We just want to make sure that that's matching so that we can make sure that they can access the appropriate benefits. So this is where we normally ask you all, what are some of the benefits that are covered under physical health? And since I'm looking at Brian's face and all I see is time, I'm like, okay, we don't have time. So I'm just going to show you all the things that are covered. And when I looked at this, I was like, oh my goodness. These are all the things that are, well, the things that are covered under the physical health plan. And I'm always struck by the transgender services. I'm like, I had no idea, right?
So it can go from more simple healthcare, like a well child check, an annual exam, to transgender services. Yep.
Mm-hmm. And then durable medical equipment. And this is what I often hear from community members. They're like, I had no idea that Medicaid pays for these items. I'm spending my own money, the little bit that I barely have, on these items. And people should not be spending money on items like crutches, finger splints, right? These are just some of the items that don't even require prior authorization from the insurance company.
Hearing aid batteries, breast pump, blood pressure cuff. There'll be like the socks and shoes for patients with diabetes, humidifier, things that we don't normally think of as being able to be, that you can get through your health benefit.
And while Lice Kits is not a durable medical equipment, it's often an item, a medication that we see families spend a lot of money on when they don't need to, right? So that says to us that we need to do a better job as a health plan, getting this information out to community and letting them know that they don't need to be spending their money on these items.
And I did see something come up in the chat talk about that PCPs, primary care providers, sometimes don't know that that's covered as well. And we've found,
yes.
So part of this is to empower the community and to have that voice so they can also ask for these that are the items that they may be entitled to.
Yeah, thank you for mentioning that. That's part of our job as well, as to continue to educate our primary care network, of these things.
Okay, so now we're switching over to the behavioral health benefit. So again, we're looking at the card and it's there on the bottom, mental health and substance use plan. And let's take a look at some examples of behavioral health services. The opioid epidemic reaches far and wide across our state into all communities. And substance use disorder, MAT, which is medical assisted therapy, this is covered as well. And so something more complex care like that, to also counseling and therapy.
This is all you, Alexa. This is your favorite.
Well, now, I'm the dental
jam.
person. I was like, Talk, you're really going to have me come and co-facilitate and present with you? That's awesome. So let's talk a little bit about dental and oral health. So just like physical health and behavioral health, you have your dental health plan and primary dental provider information on the back of the member ID card. And here is some examples of the comprehensive care package. So this isn't just if you have a certain CCO, this is the basic Oregon Health Plan benefit that all CCOs and all dental plans need to be able to provide this. They may add additional coverage, but this is the basic that is required. So prevention dental visits, cleanings, exams, preventive sealants on teeth, deep cleaning if you have diagnosed gum disease, extractions, you have fillings, silver fillings, white fillings, and then there's urgent and specialty dental care as well. And if there is a cost, the provider just can't perform a service. They would have to have the member do a waiver. And oftentimes it's good to have providers send in prior authorization so we can see if there are maybe alternative services that would be covered, just so that our members don't have to pay anything out of pocket. One of the things I want to reiterate is that there is no copay if you have Oregon Health Plan.
Can you just say that one more time?
There is no copay if you have Oregon Health Plan.
Too many times we hear from community members, what do you mean? Right? Because I'm often having to pay out of pocket for all sorts of things when I show up to the clinic.
Okay, my last little bit about oral health. For many years in healthcare, we've had the mouth separate from the body. And what we're doing now is really putting it back into the body. So we've got behavioral health that affects the mouth. The mouth is affected by all different systems. Stress, 2020 has been a little stressful all around the board. I've noticed my gums bleed more, and I'm a dental hygienist. I know how to floss, right? Do I do it all the time? Maybe not, but stress does increase gum disease. We're looking at the relationship of the body and oral health and diabetes, pregnancy outcomes, and how human papilloma virus, HPV virus, is actually causing 70% of cancers in the throat here in the United States. So this is a high level look of why we're not just thinking it as dental care, but how oral health and that dental benefit helps your whole overall health. All right, Talk, I'll be done with that. So now we're going to talk about some other services that are available beyond just what we think is a traditional health plan benefit, like medical, behavioral, or dental health. So we're going to go into these four other access to care services in more in depth.
It just is so awkward to just be like talking at people. It's just not who we are. This is not why this deck was designed. Brian, I'm looking at you. So I'm going to carry on. Language access. I think oftentimes this is another area that people may not know of, right? If you are working with an individual or families who don't speak English and need an interpreter, that is free of charge. In fact, they are required to make sure that they receive a certified, qualified, or trained interpreter. They should not be bringing their children or family members, or neighbors. That is for all OHP members.
Okay, so what is care coordination? This is a question I've had myself in my job when we talk about navigation of the benefits versus care coordination. So this is how I think of it. Navigation, you get your card, your OHP card, it's your bus pass. It tells you where you can go, who to call, because I want to get from point A to point B. Care coordination is when I need help, or maybe my primary care team says you need some help, and we're going to give you some elbow support to get on that bus, that metaphorical bus, and to help get you to where we want you to receive care or to receive the appropriate care. So care coordination teams at Care Oregon are also called regional care teams, RCTs. Those are made up of care coordinators with a variety of backgrounds, such as nurses, behavioral health, substance use disorder background, pharmacy, health system navigation. They have experience with local community resources as well. And so there's a total of 5 regional care teams at Care Oregon to help support members receive care for a treatment plan. So this is oftentimes somebody that's at high risk and needs that additional support beyond just, oh, here, we can connect you to your dental plan. So the 5 RCTs are named after bridges. And I won't go into all of them, but there is one that's actually specific for maternal child health and pediatric clinics and foster care youth. That is the Selwood RCT. Talk, did you want to add anything?
The only thing I would add is that this is a team I feel like is often underutilized, right? Because we don't understand what it is that they do. The way I think about it is, think about this team of experts as like your thought partners. Another way too to think about it is like your backup dancers, right? Like they are inside that health system and they know all the intricacies, and they could really support the work that you all are doing out in community as you're working with individuals and families. So yeah. Backup dancer, thought partners. Mm-hmm. Each of the health plans have care coordination teams. How they're designed and the pathway to getting there are slightly different, but the goal is the same. We talked a little bit about durable medical equipment, right? Then there's this other area called health-related services. Alexa, you want to talk about this, and I'll just share what some of the items are that.
So some of you may have heard back when Governor Kitzhaber was working on Oregon Health Plan and how health-related services have evolved. It's ideas of other items that are not a code that you can get at a clinic, and it's not something that can be prescribed. So what's another item that can actually help an individual with their health care and help reduce possibly an emergency department visit, or reduce a more need for health care, and reduce some of that burden on the taxpayer when that money is going into OHP and there's a limited budget and we want to spread it as wide as we can. Sometimes there's some other items, such as somebody might not be able to get that air conditioner. And that was what Governor Kitzhaber's thought was, that it was really hot and people were going into the emergency department because they couldn't cool down and they were getting ill from the heat. Well, a window air conditioner is a possible health-related service that the health plan then would provide. But there's a wide range, from gym membership to helping with housing even.
This again is that social determinants of health, right? What are all the different things that are impacting someone's health? We know that it's everything, right? One quick example is we had a young man who had anger management challenges, and the therapist, he had shared with a therapist that a punching bag is what really helps him kind of reduce some of that anxiety and anger and frustration. So the therapist submitted a health-related services request to Care Oregon, and we approved a punching bag along with boxing gloves. So
And-
that's just one example.
So since we're doing we're okay sort of on time talk. So I'm going to give
I don't know. I'm looking at Ryan. I'm like,
I was giving a diabetes and behavioral health presentation at one of our behavioral health clinics here in Portland. And one of the members of this group, it was a diabetes group, said to me, I have Oregon Health Plan, and I have diabetes, but I can't ever afford one of the ID bracelets that says that. And I said, yeah, I think that's covered under health-related services, perhaps. And I am more familiar with the dental end of health-related services, but I sent an email to talk. And the next time I saw that person, they showed me that they had received their bracelet, that we helped them understand how to get that through their helpful care coordinator, reached out to their primary care doctor, put in the request, and now they have that bracelet.
I want to make sure that we clarify that it's not a benefit, but more of a service.
Service.
So when we talk about language access and care coordination and then non-emergent medical transport, what we'll talk about, those are benefits that all of our Medicaid members are entitled to and should be leveraging, right? And then health-related services, there's a process, and we can share that information with Brian and Selby, and we can send that out for applying for these additional supports.
Oh, there's a quick question about the ID that we showed. That's not an Oregon driver's license, and is it TOC or is it? It's the ID.
It's an Oregon driver's license.
Oh, it is. So we can help if regarding funding for that is what I'm thinking. If somebody
yeah, it goes back to what you said. Are these items that a primary care provider, or behavioral health specialist, or an oral health specialist feels is going to support their overall health? Right? How does this address the current situation or the treatment plan?
So yes, there is a process, and there would need to be an explanation from their provider on why this service would be beneficial and a treatment plan. And there's a whole team that reviews this at Care Oregon. But there's different options, right? We don't know until we see what we've approved and what people need and what can come through for this service. So
again, each of the health plans, Providence, OHSU, Kaiser, Legacy, and Care Oregon all have health-related services. The process for applying for it, again, is slightly different.
All right, so now we're going to talk about non-emergent medical transportation, fondly referred to as NEMT in our acronyms. So this is the last service that's covered under Medicaid OHP. And a member can have the best care through their provider, the provider team, and the provider can't help them if the member's not able to physically get there. So I think we can all agree that without access to reliable transportation, members with complex health and social needs regularly miss out on their outpatient medical appointments. So this is another benefit that's been part of Medicaid since the program was founded in 1965, and to address issues around transportation. It's administered too. So we have right to care information. That's for health share members, but that would differ for different CCOs.
Alexa.
What was that?
No, you're like different CCOs, and I'm like, oh.
Yeah. Coordinated care organizations.
Could just get confusing. How are we doing on time, Brian? Because we're about to jump into Medicare.
I think you're doing good. Keep it going. How about 9 more minutes?
9 minutes. All right, so let's touch a little bit on Medicare, right? It's that red, white, and blue card that I referenced earlier. And it is currently annual enrollment time right now. It started on the 15th of October. So we want to get folks in there to, enroll into Medicare, because there are additional benefits. So if someone has Medicaid and Medicare, that's golden, right? You've got benefits on the Medicaid side and then benefits on the Medicare side. And then when you combine the two, there's even more benefits. So as we said, enrollment time right now, here's different ways that you can do that.
And that's why you'll see advertisements on television if you're watching TV right now. You will not see advertisements about Medicaid. That's a no-no. Like, you know, like you can't. Well, it's not that you can't advertise, but it's different. It's different is how I'm just going to say it. And so right now it is open enrollment, and it's simple. You can call either member services and ask to enroll if you meet that criteria of 65 and older or having a disability. You can do it online, or your caseworker can also, your caseworker at the county or state DHS office.
Yes.
All right.
So you'll get the OHP card, right, if you have Medicaid and you're eligible for Medicare. And then you'll get this card. And as I mentioned a little bit ago, is when you have it combined, that's where the other additional benefits kick in. If you're working with somebody who has both Medicaid and Medicare, and it's not managed by a health plan, this is where I think you all can be really helpful in making sure that members take advantage of that. So if they were to enroll in Care Oregon's Medicare plan, they would get this orange card. It's just one card. They don't have to carry a bunch of cards around. It's one number. All that information is right on this card. And then these are the benefits that we keep alluding to. So they get free eye exams and glasses every year if they have Medicare, right?
So, if you keep doing the slide, I'll address a question that came up that I saw. Why is there open enrollment if OHP's open all year round? This is where it gets confusing. Open enrollment is this time period right now. And that's why I was saying there's open enrollment advertising on TV for Medicare. It's an insurance plan. OHP, you're correct, is Medicaid, and that's available all year round for enrollment.
So love these questions that are coming in. Sorry, I can't see it. It's actually probably really good because then I'd get distracted and want to be there the whole time. So those who are on Medicare and Medicaid under Care Oregon, this is our package, right? They get the free glasses and free eye exams every year. And they also get what's called an over-the-counter card. And it's $520 every year. So that's $130 per quarter. And in 2021, that amount is going to be $760 per year. That comes out to be $190 per quarter. And what's really cool about this over-the-counter card is it has over 90,000 items that individuals can choose from. When we looked at our data of the 12,000 members that we have that are under Medicare, only 50% of folks are actually accessing and using this card. That says to us, we again need to do a better job in letting people know. When I took this out to the Asian community and I told them that Tiger Balm and Salonpas was covered, they were like, oh my goodness, I had no idea. So they went out and stocked up because I knew that that's what they use and that's what, you know, they think works. And it's this, right? What are those 90,000 items? And many of those items can even get delivered. So anyways, sorry, that's my last story. Free membership, free transportation to the pharmacy or the gym, and then free meal delivery after an inpatient stay. Every health plan has their own sexy package of Medicare, right? This is just Care Oregon's.
All right.
And this is it. Like, if you remember anything from this presentation, if you just know what the card looks like, the Medicaid card, and where to find information and who to call. Oh my gosh, Brian, I think we did it.
Great. Very nice. Thank you. Thank you both. That was awesome.
Really? Because that was a whole lot of information.
Yeah, and that's why I'm glad we recorded it and that we can send these slides out because I think it's a lot to digest. And then, you know, Talk also did a lot of work to help us develop our website. And so there's a whole page on this topic that's in kind of like a text format, so you can kind of read through all these things. Folks are saying thank you so much, and we do have some questions. So I'll read off a few questions. And if your question gets missed in this, we'll open up again for questions. So one of the questions that came in early was, you mentioned transgender services, and they were asking about what specific services were available.
Great question. Alexa, do you want to take that?
It's exactly what it sounds. Yeah, I don't know other than that. I mean, if there is a patient who is wanting to go forward with transgender, I believe it's actual surgery and then the medications. So I believe that's under the umbrella of services, but I can follow up. I'm more the dental end of things when it comes to the health plan benefit, but that's my understanding. But when talking, I don't know 100% of everything in the health plan world, but we do know who to connect with and can follow up.
Well, and here's what we forgot to mention, Brian. Alexa and I know just enough not to be dangerous. We know just enough to connect you to the right people. And that is an excellent question about transgender services. If they are Care Oregon, I would turn that card around, look at the back of it, and call that Care Oregon health plan number, and they will give you the specifics on what is covered. And you can also go to our website.
Yeah, and we'll also add that to the questions that we answer after this that we can post. I know they do cover hormone therapy and transition services.
Yes.
Pretty comprehensive.
Yeah.
Package. Another question came in about translation services. How did the doctors or the treatment providers access that?
Oh gosh, we could spend a long time on this one. Each of the clinics should have a process for which vendors they have access to, right? For example, if they are in the Care Oregon network or the Care Oregon tribe, I call it, because network is a big word, we go through the vendors that we work with are Linguava, Passport to Languages, and IRCO. And all they have to do is call one of those three vendors and say, I need an interpreter for Brian Whitmer. Appointment is, Tuesday the 14th at 3. It should be that simple. And if it's not, please, 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 I'm not even going to ask you to reach out to our customer service. I would say, please email Alexa and I directly. Because when we hear about things like that, that is our job to take that, to the appropriate places at Care Oregon, and we need to fix the system because we know that this is a systems issue, right?
Yeah, in System of Care in our work groups, we're actually working on that one and it's not just within healthcare, it's all over.
Yeah.
We need to improve that. Another question, how is it determined whether a member gets a ride or gets a bus pass for transportation?
That's a conversation with the vendors. So for us, it's Ride to Care, and they actually do have certain criteria, and they'll go through that with the patient to see what would be best, because it could be bus pass, it could be the ride, it could be perhaps money for the gas. There's different options, and that is between the vendors. So each person is unique and individual when they go through that criteria and what the options are.
Yeah, thank you. Yeah, I would just add, if you think that person needs that, help the person understand how to communicate that to Ride to Care. Because of my mental health, I can't ride a bus. I never ride the bus. It scares, whatever it is that's, I have PTSD, or help them communicate that to Ride to Care, because some folks just say, I just don't feel comfortable on a bus, and that maybe doesn't quite get to it.
So the more you can advocate, exactly. And the same with the regional care team, like the care coordinators, the more information that you can provide helps us to determine how to help the member the best.
Yeah. And even if somebody is driving, their family member to and from their doctor appointments, right? Or their oral health appointments or behavioral health appointments, they can even get mileage for that. And I think, again, that's an area that we can improve on. We have a one-pager too that we can share with you, Brian, I'm wondering too, these questions, I'd love to take these back and make sure that we answer them and then gift it back to you, Brian, and maybe you could share it on the recording? I don't know.
That's great. Yes, we can do that for sure. Yeah. Next one is, what does open enrollment mean if folks can apply for OHP or all year long? And they asked as a follow-up, is that just the medical plans that are open enrollment? I think you kind of answered that one already.
That was the Medicare. The Medicare is open enrollment. That's what you're seeing the ads for on TV. And the question, there was another question around the being able to change your medical plan. So if you have Legacy and then you wanted to switch to provider at Providence, you call the number, you call HealthShare actually. You call on the front.
Because you can change it, right? If you really enjoy connecting with this primary care provider, but then they move to a different network, you can change that, right?
I'll scan down a little bit. Somebody asked something about eligibility around, are residents eligible for Medicare?
Residents.
Yeah, I don't know what's meant by that. Does the person want to, Ruben, did you want to say anything about that?
I'm gonna.
You can unmute if you want to, or we'll just skip on ahead.
But these questions are really good. Even though Alexa has answered them, Brian, I think this just confirms again how complicated the Medicare and Medicaid system is. I'm just going to go back to the Medicare slide real quick. If I'm giving folks a headache, I do apologize.
And the Medicare rarely applies to a child. Is that right? I've never seen a child on Medicare.
If there's a certain disability, they could be.
Yeah.
Another one was, how does someone get the OTC card?
They would need to enroll with the Care Oregon Advantage program. So if you have somebody who has that red, white, and blue card and the OHP card, and they don't have that other third card that brings those two together, that is opportunity to say, who would you like to enroll with? Again, each of the health plans have their own package. And if they wanted OTC, they would connect with Care Oregon to get that. And some of them may already have it. Like I said, when I went out to the Asian community, they all pulled out their cards and they still had that sticker on it, the 1-800 number activation. And they were like, we just didn't know this was real. I was like, it's real.
And Ruben did chat in here. He meant U.S. citizens or U.S. versus U.S. residents. Who's eligible for Medicare?
Oh, from my understanding in terms of Medicare, if you have a green card, you're also eligible, right? And then U.S. citizenship.
Okay, great, thank you. We've got an oral health care question. Can we get braces covered for the foster youth?
There is a very limited benefit for orthodontics through our dental plan. It's under, there have to be certain criteria and it's really specific. And I think in the 5 years that I've been at Care Oregon Dental, we did cover braces either, I know of at least once, perhaps twice. So again, to be an advocate is always in the best interest because you never know unless you ask. And but for general orthodontia, for braces, that is that's not within the scope of Oregon Health Plan, the basic coverage. So again, though, there are certain criteria and that would be reviewed by the dental plan's dental directors to see if that is something that could be covered.
Thank you. We've got a couple.
Brian, can we go back to Ruben's question? It made me think of our children who are covered under Cover All Kids. I think that's one thing that we should have mentioned in the very beginning. We normally do, we forgot, is, you know, because of Cover All Kids, every child should have Medicaid. And if they don't, that again is an opportunity for us to enroll them into Medicaid Oregon Health Plan so that they too can access these services. For our families who are undocumented, let's say parents are undocumented, but the children are covered under OHP, as they should under Cover All Kids, they can access these services as well, you know, because how we show up is helping the whole family, right? If a family is about to be evicted, and that's going to impact the overall health of everybody in that family, that's where health-related services, that piece can really come in and support that family, along with care coordination. So I just wanted to, Ruben, thank you for mentioning the U.S. citizenship and residency. That reminded me.
Thank you. Yeah. We have a couple of questions that are behavioral health related, but access to care. And we do have an upcoming in a couple of weeks, a behavioral health specific one of these trainings. So we encourage you to check that out. But here's the questions. There are huge barriers to getting inpatient care for complex behavioral needs. Seems like I should be helping those families access a care team? Question.
Yeah, I think that's the short answer, right, Alexa? We can send you, well, I think, Brian, you may have that list, right? The care coordination contact.
The RCT contacts?
Mhm. If they're
Yes.
Providence, there's a email for Providence, OHSU, Kaiser, Care Oregon. We can send
Well, if behavioral health, it's always Care Oregon, right?
Correct. But in
Yes.
terms of care coordination, yeah.
Yeah, so for these behavioral health questions, yeah, if you're struggling to get access to care, there's multiple ways to get care coordination, but the first stop is, call Care Oregon and tell them the situation. Actually, the first stop is call that behavioral health provider that's already involved and say, hey, how can you help us get this child the access to care? And if they say they don't know, you might want to ask their supervisor. And if you still get, and this is kind of the story we tell over and over again, and navigating services is hard. And I know it's a lot of phone calls for you all, and this is just the sort of struggle that we all live in. I've been doing care coordination for 10 years. It is all about persistence. It's all about calling up the chain of command and call the health plan, explain the situation, and they'll connect you with the right people. I think the same person asked a follow-up question around Open Card. Do they have to go to a CCO for a higher level of care? Concern for loss of physical health doctors.
Oh, do you know the answer to that with the Open Card? Do they have to, what was the question again?
For higher levels of care. So I think it's actually dependent. I work in the behavioral health world.
I was going to say, Brian, answer that one. Yeah.
Yeah. So, like if you're talking about inpatient care at a hospital, that's covered by Open Card. I'm pretty sure subacute and psychiatric residential treatment services are. Where you get into it is like provider specific stuff. Like some of the intensive community-based treatment services do take Open Card, some don't, but most often you're going to be able to get that care. It's really on whoever the current behavioral health provider is to help you navigate that. And if they're not helping you, again, you can call the health plan or the behavioral health plan at Care Oregon and say, I'm not getting a lot of help here. This kid needs help. If they're Open Card and you're like, well, I can't call Care Oregon, that is a big part of the problem with being on Open Card. You don't get access to that care coordination.
Exactly.
But if you call the county mental health programs, they'll often be able to help you. There is a number online for support with care with Open Card and behavioral health. I'll look that up while we wrap up here. But
and Brian, if they're a tribal member, if they're part of a tribe, right? We manage that at Care Oregon as well, so they can definitely call again. The number on the back of the card. I saw somebody asking in the chat, who is it that we call? And I'm like, I know I feel like I sound like a broken record. I never realized how important that card would be, but it is that number, and they will connect you to the right people.
Yeah.
And if that's not working out, email Alexa and I, and we will make sure. That's why we're putting our face out here, right? And saying like, we're serious about this. Like, it is complicated and it shouldn't be that way. We who work in the system need to make it a lot easier for you all.
Yeah, those higher levels of care are a covered benefit of Open Card. The issue is finding the provider. And it's, that's really up to whoever that behavioral health provider is to help you through that. And if you're not getting that kind of help that you need, call their supervisor. And again, the counties have behavioral health programs that help people navigate through some of that stuff, which you can find all that information on our website under the behavioral health tab.
Can I just say how appreciative I am of all these questions?
Yeah, these are great.
Yeah. These are excellent questions.
Let's see, there's a few here. Let's see, does that count as public charge if undocumented parents enroll? When we're talking about the enrollment.
That's a good question.
Oh.
I think, again, Kate, we're going to go back to get all this information and
Mhm.
then plug it into where these questions are. That's our homework, right, Alexa?
Awesome. Thank you for offering that. That's great.
And I see a question, a client who has Medicare, can this client apply for Care Oregon Advantage? If they also have Medicaid, if they have the OHP card and they have the red, white, and blue card and they just need it to be managed by a health plan, they can definitely contact Care Oregon. Again, each of the health plans all have their own sexy package. It would be up to the individual what package, you know, they prefer.
Here's one, let's see. Are incarcerated juvenile offenders able to access all of the Medicaid services that are available to non-incarcerated juveniles? And can their cases be eligible for care coordination?
Are incarcerated juvenile offenders. What does that mean? They're not incarcerated.
So this is saying juvenile offenders. So I'm guessing you're talking about if they're in an OIA system, the Oregon Youth Authority system, what happens with their OHP? And actually, they lose their OHP. When you're in OIA, they have their whole own insurance system, and so they say it's double dipping for you to have both. It's a real barrier to care because they have a smaller network of services that aren't maybe as specialized, and then also because when people leave OIA, there's like a gap there while they try to enroll for OHP, and it is a struggle for sure. And you know, all of our friends in the OIA world and the juvenile justice world really struggle with that barrier. And it's been raised to the state on multiple occasions, and we're trying to alert them to that. But they do have access to services just paid through that different pot of money. I think we're done. We're at exactly 1 p.m. Awesome. Thanks everybody for coming. We appreciate you